Hello, I'm Dr. Todd Morgan. I'm a dentist and the co-inventor of the ApneGuard Trial Oral Appliance System. The ApneGuard system was developed specifically and uniquely for use in the hospital environment or the sleep lab environment, and designed as well to be fitted by any trained health professionals such as sleep techs, nurses, physicians, and anesthesiologists. For the purposes of this tutorial, I'd like to focus on the sleep lab environment and the technicians fitting the ApneGuard to the patients. There are two things to consider in this circumstance. We've got a medical point of view to consider and a dental side to consider. And let's talk about the medical considerations first. We know from research, recent studies have shown that certain aspects of the medical condition of the patient will predict good outcomes with oral appliances, including the ApneGuard. We know that those things are lower BMI, a lower apnea-hypopnea index, and positional apnea. In other words, if the patient is twice as bad in the supine position as their side, they're going to be a good candidate for the oral appliance system, despite even severity in those kind of cases. From the dental side of things, we want to look at physical characteristics, and it will require for the technician to take a brief look in the patient's mouth, because after all, we're going to be selecting the proper size for that patient's physical characteristics of the mouth, size of tongue. So let's take a look at a patient here on the computer. This is a pretty typical case of a patient who has OSA. This patient is not terribly obese, and he's 66 years old. We can see here that he has at least 8 teeth in the upper arch, and he does in the lower arch as well. In the retracted view, we can see, and this is very important, that we have a narrow arch form across here. We know that the narrowness of the dental arch means that there's a narrower pharyngeal airway. The tongue is another important thing to look at. You see the tongue looks large, riding high up in the mouth. It even has the indentations of the teeth on the side. We call this scalloping. So when you look at a patient, you can see these things pretty easily. What the ApneGuard does the best is correct anatomy. Oral appliances are designed more to bring the chin forward, expand the airway, and we do that best in these narrow arch forms. So now we can say that these physical characteristics that we can see really just with a good light and peeking in there is a good candidate for oral appliance therapy and the ApneGuard trial. It's very simple to do a quick exam of the TMJ just to make sure there's no pain or problems right now. It's okay for the patients to have a history of TMJ problems, and a lot of people do, but we just don't want ongoing problems at the time that we treat the patient. So it's easy to check the patient if you just have the patient open and close, side to side, and protrude a little bit, and they can do that without any discomfort. Then really that's a fine way to qualify the patient from a TMJ aspect. So let's remember that what we're trying to do to get the ApneGuard trial done is do a general qualification, a general exam, and just get an idea of how the patient's dental health is. We have a questionnaire for the patient to fill out, and it's important for them to fill that out. There are questions on there that will help us understand if they qualify for an ApneGuard trial. Patients know how well their teeth are, and they know about their oral health for the most part. So the combination of your look in the mouth and looking at the questionnaire, we can figure out if they are qualified to wear the ApneGuard. There are certain definite contraindications to using the ApneGuard. The first one is no one under 18 years of age should wear an ApneGuard. If the patient also says in their questionnaire that they have temporary dental work going on, current TMJ pain, or current loose teeth, fractured teeth, or infection, then those are contraindications for use of the ApneGuard. Some patients, when they're fitted with the ApneGuard, they feel like there's a lot of bulk in their mouth and it's uncomfortable. So really those kind of patients probably aren't good candidates for a trial as well. If the patient does well with the ApneGuard trial overnight and they feel comfortable, then you can go ahead and send the patient home with the ApneGuard trial appliance and use that during the 30 days it takes sometimes to get them to the qualified dentist to make the custom appliance. What's also very unique about the ApneGuard appliance is it transfers the position of the jaw exactly to the custom for the dentist, so there's no guesswork. In the sleep lab, we have looked at the parameters and we know the AHI improved, oxygenation improved in this position based on our algorithms here. So we know that the custom appliance, if put in the same position, will also do very well. Now, many patients find the ApneGuard bulky and a little uncomfortable, but once the trained dentist gets a hold of them and does the custom, those objections are generally taken care of. Once we have a response from the patient with the ApneGuard and the overnight sleep study, as I said, it's okay to let them go home with that and then transfer that setting once they meet the trained and qualified dentist to have the custom appliance made. The ApneGuard is FDA cleared for 29 days use, so it's important to get the referral done quickly to the dentist. With a little practice and fitting a few patients, almost everyone can develop skills needed to fit the ApneGuard. We hope that you can use the ApneGuard and have some fun with it in the sleep lab and develop protocols that fit into your particular needs. Thank you for listening.